The first complication is the one that is most common. That is postherpetic neuralgia, or PHN for short. We know that shingles can be very painful. It can burn. It can be irritating, almost itchy. What can happen, and this happens in probably 10 to 18 or so percent of the population, or people who get shingles, is even though the shingles rash goes away and resolves, the pain, the itching, the burning, the irritation can actually still remain in that same spot where they had the shingles rash. And guys, this is a big deal. I have patients that need medications, still need to take medications for this postherpetic neuralgia. This postherpetic neuralgia can last for months or even years. As I mentioned, can be completely debilitating. The chance of it tends to increase with age. It's actually one of the reasons why getting the shingles vaccine is super important if you qualify for it, which many people do if they're over the age of 50, because this is one of the complications that really can be tough. All right, let's move on to the second complication. This one is called herpes zoster ophthalmicus, okay? And by the way, as a family doctor and as a physician, when I see this complication, it puts me on high alert. Let's put it that way. The reason why is because the herpes zoster virus is in nerves that can affect the eye. As you can see, the rash often goes around the eye, may affect sort of the eyelids. Sometimes people actually get a little bit of a rash on the tip of their nose before they get the eye symptoms, interestingly enough. But the thing about herpes zoster ophthalmicus is it can actually potentially cause blindness, right? And it can cause eye problems. This is not what we want. In other words, it can be very, very dangerous. So with patients that I have seen in the past that have this complication, they are immediately sent to the emergency room or to an eye doctor ASAP for a prompt evaluation. Without a doubt, this is something that you should know about. So it's very important to keep in mind because, again, it could result in vision loss. This third complication is called Ramsay syndrome, or herpes zoster ophthalmicus. Not the eye is affected, but in this particular situation, the ear. There's often ear involvement. It can actually sort of seem like a stroke, or someone's having a stroke, because they could actually have weakness or facial drooping. They could have problems hearing. They could have muscle weakness, problems with their tongue, vesicles in their ear canal, again, hearing problems, etc. This is something else that you want to make sure gets evaluated right away by your doctor, and you just make sure you know what's going on. This is a more rare complication. So those are three complications you should keep in mind, but there are other things, right? So it could also eventually cause pneumonia in people. It could cause an inflammation of the spinal cord, the brain and the spinal cord, called encephalitis. There are other complications. It's just another reason why making sure that you get the shingles vaccine if you qualify is very important. If you're wondering if you qualify, take a look at some of my other videos. I'll put the video links in the description, or you can just send me a note. Just ask me to send you those videos. I will do that right away. Guys, I'm Dr. Jen Caudle. I hope this is helpful. Let me know if any of this stuff has happened to you, or you know others who it's happened to. For those of you on Facebook who like and follow my page, I so appreciate you. And those of you who send stars, I respond promptly to you. Thank you guys so much in advance. On YouTube, excuse me, YouTube, thank you guys so much for subscribing to my channel. Click the little bell for updates. Also, guys, I have subscription groups on both Facebook and YouTube where you get exclusive content. Check out my website as well, drjencaudle.com, for my free health newsletter, as well as my new offering called Dr. Jen's Daily Health Tips. Guys, I'll see you soon.